I am Celeste Douglas, and I am a physical therapist at the Wheelchair Seating and Mobility Clinic at Shepherd Center in Atlanta, Georgia. And this is Dr. Spriegel. I'll let him introduce.
In Atlanta, Georgia.
He's much more than that, as many of you know. All right, so our topic today is wheelchair considerations for tall people with spinal cord injuries. Oh, let me grab the clicker. All right, so the data that we looked at is specific to people with spinal cord injuries, but in practice, the wheelchair users. Here is our formal disclosure statement. We have no conflicts of interest, financial relationships, or disclosures relevant to this presentation. So here are the learning objectives we have for today. Hopefully by the end of this hour, in a person's height and risk of spinal cord injury, according to the databases that we looked at. Number 2, we hope you'll feel comfortable with knowing at least 3 strategies for individuals. And number 3, we want you to be able to apply today's case studies to your own clinical decision-making when it comes to addressing the challenges of prescribing. Includes center of gravity, seat to floor heights, and we're also going to discuss the trade-offs that come with most changes that you make to someone's custom seating. All right, so my curiosity around this topic started when I started working at Shepherd Center, World of Pediatrics. I wasn't sure if it was just my own perception that everyone suddenly seemed really tall, or I wasn't sure if this was a Shepherd specific or Atlanta. And so and then the other thing I noticed was we had a lot of people that were at least 6 feet tall, but they also seemed to have cervical level spinal cord injuries compared to thoracic or lumbar. So I tried to do some of my own research. There was any relationship there. If it was, more likely that taller people would sustain a spinal cord injury compared to shorter people. And I found some information, possibly need back surgery, but I didn't see anything specific to spinal cord injury. So that's when I approached Dr. Spriegel with my question. And I kept coming back to this very basic, simple analogy of a long, thin wooden stick compared to a short stick, right? So a storm comes through, and you have this long, thin bird snap than a very short stick, right? Or a short branch from the same height, from the same tree. And so I created this hypothesis in my mind that tall people are like a very long lever arm compared to shorter people or a shorter lever arm. So again, I asked Dr. Spriegel if there was anything behind this and if there was any relationship there, and this is what he came up with.
Yeah, this was an interesting question. So I think the first thing we wanted to do is take a look at a database out there. It's called the Civilian American European Surface Anthropometry Resource. It was done in the late 90s and early 2000s and funded by a lot of companies that make anthropometry of people. And there are about 2,400 adults in this data set from the United States. And you can see that the average height and the median height are about the same, about 67 inches. And then we calculate percentiles, right? So the cool thing in deviation, it has a very consistent breakdown of percentiles, right? So one standard deviation over the mean is the 84th percentile, and that's at 5 feet 11 inches and about 1.6. That's the index, 72 inches, right? At least Celeste was sort of hypothesizing this 6-foot thing, and ironically enough, that is the 90th percentile. And so then you start breaking down with about 10,000 records from the spinal cord injury database and did the same thing. And we just said, how many people are below the 84th in the general population? How many people are below the 90th in the general population? What happens? 84th percentile in this distribution of 10,000 people. It should be 16. And 18% of people in the spinal cord injury database were over 72 inches tall. It should be 10. And so now you're starting to see, wow, this is like really wild. So we did just a regular normal curve, and then a histogram of people's spinal cord injury. And it sort of jumps out at you. Granted, there are short people with spinal cord injury. There's a hunk of people under 5 feet in the general population, and spinal cord is kind of interesting because there's a lot more taller people. And so a few other tidbits, right? You can run a chi-square. Chi-squares assess the relationship between things, and so we could assess the relationship between category and injury severity. Injury is in these 4 buckets of a high C, a low C, a para, and an Asia D. And then the chi-square basically says, is there association between these 2 variables? And in fact, there was a significant association. Chi-square doesn't expected values versus the actual values. You can sort of see below this that there were greater number than expected in the high and low C's, and there were less than expected pairs. Starting to see an association between injury severity and stature. A couple other tidbits is we can run odds ratios about etiology and height. Odds ratios are best in like a 2x2 array, and you start to see again are 1.3 times more likely if you're above the 84th percentile than if you're below. And vehicles are also higher than other etiologies. There's a lot of other etiologies in the database, as you might imagine. Multiple sort of interesting confirmations about this relationship. So Celeste was right.
My favorite slide.
But but opportunity is what she's going to talk about now. The opportunity is about identifying strategies and trade-offs and prescribing fluid mobility and seating for tall people. That's her account. Yeah.
Thank you. All right. So given that we have higher than expected number of people who are 6 feet 2 inches and taller, it really is worth considering if we are creating equipment that adequately fits. Let me go back. So these are the critical considerations that we're going to talk about today. Seat to floor heights, wheel sizes, seat slope or seat jump, front frame angle, center of gravity, suspension in power wheelchairs, as to steering wheel and driving controls for those who are driving from their wheelchairs. And then also some manufacturer sizing limitations when we're trying to get equipment that really appropriately fits these individuals. All right, so we are going to start with manual wheelchairs and wheel sizes. The rear and also the ground clearance underneath that foot plate. And it also affects the client's upper extremity access to the wheel for efficient propulsion. Larger front casters at larger diameter decreases rolling resistance. However, the trade-off there would be that that larger diameter caster would be more likely to bump into someone's feet and possibly have that interference when that caster is turning or spinning. Wheelchair, you want to look at the person's elbow flexion, shoulder angle, and see if they're sitting too high or too low between those rear wheels. And again, the size of those wheels does affect efficiency. Okay, so the images when you change the diameter of the wheels. The first picture on the left is a wheelchair with 24-inch drive wheels and 4-inch casters. The image in the middle is that same wheelchair frame. As a result, the seat to floor height is now 1 inch taller or higher off the ground, so the footplate also has an The third image on the right shows what could happen if you start with a chair with almost little to no seat slope, and you add a larger rear wheel without making any changes to the front caster fork, or just if you only change to that larger rear wheel. And in this case, the wheelchair user would essentially be sliding forward out of the wheelchair. That's kind of an extreme example. So for taller individuals who have longer legs, you have to consider how you're going to while also not raising their knees too far off the ground and getting interference with sitting underneath tables, desks, work surfaces. And also, we're going to talk about hand controls and steering wheel. All right. So this is Jared Greer. He's brilliant. He's awesome. He's very creative. He also has a spinal cord injury. His level of injury is C6, and Jared is 6'2". So we want you to keep in mind that range that we're talking about today. So when we're talking about changes to this wheelchair, it might have an even more significant impact on someone who's taller than that. Also, I just want to note that this is not, he does have his own custom wheelchair. This is chairs at Shepherd. We found one that roughly met his body dimension, but that we could easily change the rear wheel and the casters. So here we switched from 4-inch casters to 6-inch casters, and this is just a clearer view of that, an anterior view. Whoops. There we go. So again, when switching from 4-inch casters to 6-inch casters, we increased that ground clearance by about 1 inch. And this can make a big difference. The next thing we looked at with Jared was the impact of switching from 24-inch wheels to 26-inch rear wheels. So for Jared, the larger wheels actually resulted in a little bit too much elbow flex of his wheels. And this was a less optimal elbow angle and configuration for him for efficient propulsion. So in order for him to be able to more comfortably and efficiently use those larger drive wheels, we'd also have to conveyor between those wheels. So raising that rear seat to floor height, as I'm sure you all know, can be done in different ways. My personal preference is to do it through the frame itself, especially once we've established. But if you're trialing things and you're not sure, you can use a base wedge turned backward to create a very similar effect. And that's what we did here. So we used an anterior base wedge. We turned it backwards to Jared's rear seat to floor height. So his amount of seat dump went from 2.75 inches to only 0.75 inches of seat slope. Excuse me. So he had slightly better upper extremities, but he did notice that he had decreased postural control when we reduced that seat slope, which can happen because you have a little bit less pelvic control and stability. Also, the balance. So this is something just to keep in mind, that if you have someone with a tension adjustable back with limited ability to raise that height, if you experiment with this, that can affect their sitting balance. And the other thing that Jared noticed that he didn't love was that the sound. So in these pictures, Jared is trying to reach down to the ground, his left-hand side. And in the photo on the left, he has the 24-inch wheels. In the photo on the right, he has the 26-inch wheel. And with the 26-inch wheels, he's not bleeding easily because that 26-inch wheel is digging into his rib cage and his side. And he said that was uncomfortable, understandably. So with taller individuals, it's also important to remember that they are sitting with a higher lateral reaching. So depending on the client's profession, their career, their goals, maybe how they do ADLs at home, you may want to consider camber to be able to increase that lateral stability with lateral reaching. But of course, the trade-off with that is that there are a lot of doorways. Similarly, because tall people sit again with that higher center of mass, they're also going to have more anterior posterior instability as well, with forward reaching and reaching behind their chair. So as always, it's really important for reaching and also wheelies. Okay, we're going to go into some case studies now. All right, so this is Grant. Grant is only 6 feet tall. His seated height is 56.5 inches, or the equivalent of 4 feet 8 and a half, when talking about seat to floor heights for power wheelchairs. So for taller individuals, it can be a challenge when entering and exiting vehicles to not hit their head when they're trying to get in and out of their vans. But then, so a lot of them have to tilt some to be able to get in and out of it. But it becomes a safety issue that they can't really see where they're driving when they're getting in and out of their vehicle. I'm sorry that we have some of this cut off on the bottom. So At Shepherd Center, we're really fortunate. We have 2 occupational therapists who run our events for vehicle clearance. So height clearance for minivans is usually between 53 and 57 inches. And again, just as a point of reference, Grant's sitting height is 56, and the tallest vehicles available without having to tilt back. So if someone is driving their vehicle while sitting in their wheelchair, another consideration is how high up are their knees. If their knees are sitting too high up, it could bump into and interfere with the steering wheel or their hand controls. So it's from the floor to the hand controls of 3 of our different adaptive vans at Shepherd. The smallest minivan had 28.5 inches from the floor to the steering wheel and 27 inches vehicle. The minivan had 33 inches to the steering wheel and 30.5 inches to the hand controls. So again, using Grant as our example, his seated knee height is 27.5 inches with the hand controls of smaller minivans. But fortunately, he can fit under most of these driving setups. But again, someone who's taller, it could have more interference. So then you have to figure out what's easier to do, modify the vehicle or modify the wheelchair. And a lot of times that depends on which they own first. For Eval, he is 6'2", and his level of injury is C5. And he was very clear. His number 1 priority when arriving to his appointment was, I want a new chair, but I have to sit as low as possible to sit into my vehicle. A cell cushion to a more aggressive seat cushion for pelvic positioning and control. And when doing that, when we trialed cushions, that also sat him up a little bit taller. Which he said he was willing to sit that much taller, but not any more than that. On the power chair, is that he has very long legs. So he arrived sitting, it's hard to see in its image, and I was hoping to have a little laser pointer here, but there's 2 anterior base wedges stacked on top of each other to try to accommodate his lower leg length so that his foot plate wouldn't be dragging on the ground. At height as low as possible while still accommodating his long lower leg length. This is just a clearer image of what that anterior base wedge looks like. So it's a wedge that covers the width of the seat and can be placed underneath a seat cushion. We typically, things are not sliding around underneath the client, or you can put it within the seat cushion cover. I think that's a little bit more aesthetically pleasing, so it's not as visible. And it's about 2 inches tall in the front and the lower leg length of the individual. So these can be used when you've already raised that front seat to floor height of either the power chair or the manual chair as high up as you can, as available. And as low as possible if needed, while still accommodating that long lower leg length. Another potential benefit is it can improve some sitting balance and pelvic control with adding that seat slope. A trade-off would be that increasing the seat slope that can make your depression transfer or slide or transfer, because they do need to have the strength to be able to scoot uphill to be able to get to the front end of their chair. And as always, whenever you raise that front knee height, you have to be mindful of whatever desks or tables they need to. You always want to check hip range of motion, make sure that they actually have the available hip range to be able to do this and use this effectively. If not, you might need to consider making other adjustments like opening up a back ankle. All right. Excuse me. This is Demetrius. He is 6'2" to his seating clinic appointment with his foot plate just dragging on the ground. He was essentially living in a wheelie position throughout the day so that he wasn't scraping the ground all day and hitting obstacles. And I first got his chair, but I think over time, the things getting slung out and worn out, he had to get lower and lower to the ground. So if we just raised up his foot plate, his thighs would be floating off of the seat cushion, thighs. But the problem was that his chair had already been raised as much as possible for that front seat to floor height. So yes, it was already raised up as much as possible with his existing casters and caster forks. So there are different ways that you can address this. You could also order taller casters or taller forks to be able to raise up that front seat to floor height. He really liked his caster size though, and wanted to keep his casters if possible. So what we ended up doing was ordering extended floor height. This was also an opportunity for us to think about what we might do differently when he's eligible for a new chair. And the front frame angle on his current chair is 85 degrees. So for him, we come to sit with his feet a little farther forward and accommodate his lower leg length better. But of course, the trade-off with that is increasing that turning radius and bumping into more obstacles potentially, especially in tight living situations. All right. So it's important to keep in mind that they dictate where the person will actually have their feet, right? So in the first image on the left, it shows a person sitting in a wheelchair with a 90-degree front frame angle. And the person's feet are resting a little bit forward on that foot plate chair with that 90-degree front frame angle, but they have their feet tucked back a little bit farther on the foot plate. And then the third image on the right is a wheelchair with a 100-degree front frame angle, and they have more ground clearance under their feet, but as you can bump into obstacles and increasing that overall turning radius of the chair. Okay, this is Eli. Oh, I'm so sorry that that's cut off on the top and bottom. Eli is 6'7", and his level of injury is C3. And in addition to his C3 spinal cord injury, so because of his tall height and that amputation, his center of gravity is even higher up and more posterior than the individuals we've talked about so far. So with a client this tall and with their center of mass so post pressure relieving weight shift, it's important to talk about suspensions and center of gravity. And I'm embarrassed to admit this, but I learned this the hard way in our clinic. So in 2021, a few inches shorter than Eli, and this person had a right above knee amputation. And we were trying to do some education about the purpose of power tilt weight shifts and, trust your chair. I'm in a demo mid-wheel drive chair. And we said, trust the chair, it's going to be great. Like, you'll feel the difference. So he starts tilting all the way back, and I'm saying, yeah, and you have to go all the way back for it to be most effective. And thankfully, I am not very tall. I was with a very tall and strong supplier, and between the two of us, we caught him. He did not get hurt. We brought him back upright, but it left an impression on me. So now I always have that conversation with my supplier and with manufacturers if needed to talk about these rare circumstances. And it also led me to do a little bit more investigation. So I started making some phone calls. So I talked with 4 different manufacturers, international standards or guidelines. So center of gravity on a power chair is usually determined by the seat pan length, or the depth, I should say. And suspension is usually determined by the client's weight and or the weight of the chair itself. This weight is actually distributed in the chair. So if you have a really top-heavy client, again, this algorithm may not capture those situations. So it's just something to be mindful of and to make sure your height's right so that if you need to adjust something at the fitting, you catch it right away. Another challenge with people with these taller torsos is the more limited back height options. So I looked at 6 different back support manufacturers and only one 22 inches tall for the back shell. Now, I will say, since walking around the exhibit hall and asking questions, I could add maybe 1 or 2 more to this list, still heights, but it can still be hard to find because it's just, you don't always need them. And so they're just not as readily available. So we're going back to Eli. Eli, again, is 6'7". So he was getting a power chair, but he also wanted a backup manual wheelchair, wanted a tilt and space manual chair, and in lateral thoracic supports. But we needed those lateral thoracic supports to be high enough for his tall torso. We wanted that back height to be set at 28 inches from the seat pan. Had in mind that had the contour that we wanted and the placement of those laterals, it was only available in up to a 20-inch tall back height. So what would happen is that would leave an 8-inch gap between the back to slide back through. So we wanted to use this as an illustration of that. So this is an illustration of what a wheelchair might look like with a 20-inch tall back support. You can move it up as high as you want to accommodate that tall torso, but between the backrest, between the back support and that seat pan. And what happens is you no longer capture the PSIS of the pelvis, and it can lead to non-optimal support and posture. So it would be nicer to have taller back support options, putting lateral thoracic supports on it as well, and needing them up high enough. All right, this is Lamar. Lamar is only 6'1", so he's a short, tall person. And Lamar, sorry, let me find this again. So Lamar, his level of injury is C4, and he was interesting because I took his measurements, and his legs were not exceptionally long, but he had an incredibly full torso. So his seat pan to top of shoulder height is 30 inches, and we wanted his back height to be somewhere between 28 to 29 inches from the seat pan. 7 inches, which we made work, but again, was not quite as precise as I would have liked. The other challenge with him is that he had a scoliosis, a scoliotic posture that was flexible. And so we needed lateral thoracic supports that were off. So in order to be able to get the lateral thoracic supports up high enough, we had to order taller tracks to be able to mount those lateral thoracic supports up higher. So this is a picture of that. So these are actually standard height tracks for the lateral thoracic request taller tracks to be able to position those lateral thoracic supports high enough and also be able to offset them to try to correct that curvature. But yes, this is not to take that measurement of where you want those lateral thoracic supports and how much you want them offset, if you do want them offset. Because you want to catch this before the delivery because you don't want to end up in a situation also requiring possibly additional medical justification, right, when you're making these changes. All right. So in summary, we've talked about a lot of things, a lot of considerations for prescribing equipment for taller individuals, including wheel size, seat, both manual and power wheelchairs, vehicle clearance, seat to floor heights, and manufacturer sizing limitations. Okay. And again, it's really important to talk with the client because you can make these changes, but then if they go home and they can't fit in their environment. So yes, when making these modifications and accommodating for taller and longer body dimensions, these are examples of some of the trade-offs that need to be considered. So when you're trying to keep that floor to top of head height as low as possible, lower leg length, that could lead to difficulty with transfers. Increasing the ground clearance under the foot plate may raise the knees higher and interfere with fitting under work surfaces, tables, desks. Camber can increase that lateral stability, but increasing the wheel sizes may improve that overall ground clearance and seat to floor height, but affect propulsion if other adjustments are not also made. And that long front frame angle can, again, but will increase that turning radius. There's always room for improvement, right? So it would be great to see more sizing options for these taller individuals. I know it's a big topic of conversation in the bariatric population, but I think it's all our thinner folks as well. And I'd love to see if manufacturers, if their configurators, could automatically account for where weight is distributed when they automatically set where that's. So, that's it. So I hope you found some of this information useful when thinking about how you prescribe equipment for taller individuals. And we do have a lot of time for questions if you have any. I think so. They go to mics.
Great presentation. Thank you. Was curious in the beginning when you were talking about the statistical analysis. Did you separate out at any point just like the percentage of men over 6 feet or 6'2" or whatever those deviations were, and how that was differentiated, or the numbers you presented included?
According to that, and then I was like, I didn't know why. Hey, we're looking at stature, right? So you're sort of looking at the potential biomechanical associations. And I didn't know what like, um, and women are, you saw up there.
Yeah, yeah.
Yeah. Women are shorter.
Oh, it's not letting me anymore.
Yeah. But
They took away my
I
controller.
did look at that and nothing really changed much. Women are smaller. There was a pretty good pronounced effect. Yeah, right there.
Is this what you're looking for?
Yes, you can see, the mean height is like 5 inches different or so. And then the 84th and 90%. I don't quite remember everything because I abandoned it, but what's that association?
Hmm.
It did not, it had more of an effect, I looked at 84, 90, 95th percentile at the beginning, but I was like, this is crazy. I mean, look at the difference. It's not that much. Uh, but we're a little different, right? They were just a little bit different associations. Sports wasn't as dominant in women as men. I don't think that's Herculean surprise, right? But the association was still there, in men for some reason, even though it's only 68 or 67 inches, which to me isn't all that tall, I guess. I don't know. Y'all can answer that question.
Go ahead, by Mike, yeah.
You have your vendors come and adjust your loaner chairs when people are going to rehab to account for that center of mass? Or
If we are there as seating therapists with our suppliers for loaner wheelchairs, we see far fewer power chair loaners now than we used to be able to get from suppliers. But yes, we try
can
to,
be adjusted in the field, we do that a lot, but
Yeah.
you mentioned like the center of
Mhm.
mass based on seat depth, we'll have vendors change seat depth all the time.
Yeah.
But I don't think to ask.
Yeah.
To kind of reset that center of gravity or to check.
yeah, and it doesn't, and for loaner
Yeah.
chairs, I would say we don't see that as often, but definitely for a custom chair.
I was just thinking, because we've got some folks that sit in those loaner chairs for months going.
I know.
Rehab and it's
I
not.
know. Other questions? Oh, over there.
Hi, Celeste. I just want to ask, that slides that you showed us about that 6-inch gap. Is that the cushion?
Pan.
Okay. So,
But yes, cushion 2-3 inches would eat up some of that space.
yes, but would it change it would eat up that, right? So would that be enough? The 2 to 3 inches that is missing, still enough to provide that PSIS support?
Thing is that for these exceptionally tall torsos, that it's not.
Thank you.
recommend. Yes.
Hi, I'm Linda Valent from the Netherlands. I'm an OT working with spinal cord injured, and perhaps because we drink a lot of milk in the Netherlands. In the Netherlands, when people are that tall, I mean, for me, inches are a bit difficult, but 2 meters and 10 centimeters, I don't know how much that is in inches.
I know, American.
But then we often, it's possible to apply for a wheelchair that's custom built, because that's the only solution. I was wondering, is that possible in the United States?
And in walking around the exhibit hall yesterday, and that's a point that was brought up multiple times, like, well, you can do custom, you can do a mold, you can do, yes, that's an option. And if there aren't other postural abnormalities or any symmetries, I try not to necessarily go that route, I would say. Because I just think that
Question, in the Netherlands, we use the ergo seats quite a lot.
no, I'm sorry.
The ergo seats. It's the ergo seat.
Oh, ergo seat, yes.
And that sometimes helps to give to have the pelvis more stable. And we also have I don't know if you know it. It's the ILSA. It's a bit like support that you can. But if that means we can achieve that people sit good in the
That's great.
Yeah.
Yeah, I love hearing about other strategies as well.
Yeah, that's true.
It's fabulous.
So databases from 3 countries, Italy, United States, and the Netherlands. and Netherlands are freakishly tall for sure. But if you want to see the data from the Netherlands, just send me an email and I'll send you the demographics of the Netherlands. It's kind of interesting. I don't know why they picked those three countries, but it was,
That tracks.
Just a question for the gentleman that almost tipped. Was he in a mid wheel or a front wheel?
It was a mid-wheel, and it was a demo chair. So again, it wasn't his custom chair. It was a demo. So hopefully, factor that he did end up opting would account for that. But again, that was a demo chair. So we just made sure that we adjusted and tightened the suspension on that particular trial equipment that we were already set up for that. Yeah. Thank you.
Great presentation. Thank you. I think you brought up a lot of good concepts for tall people, but also people with tall torsos or tall lower legs. This is more of a request, as you mentioned, but not just make your exact same backrest taller, because the thoracic spine has a different shape than the lumbar spine. And I find sometimes that it's then pushing them forward.
Yeah.
And yes, we can do custom, but as you said, it's nice to have off-the-shelf options that work well.
Yeah. Thank you.
So we've got questions.
Sorry. I don't mean to ignore this side of the room.
Ontario. Thanks for your presentation. One of my, thanks also for talking about the tipping of it's about 6'2", but built like a linebacker. And one of the considerations, he works out in his chair, so he'd want to go into tilt. And so yeah, that was, he was 275, with, so he fit the weight that needed to be a consideration. So yeah, that was one thing.
Were you able to trial that in clinic?
Yeah. But, yeah, but I still, that comment on the center of gravity, impacting it for sure when you're talking to me.
And also probably important, the education component about the intended use, of equipment as well.
For sure. Just my other question. So one of the things I'm often struggling with is, going between 24s and 26s, and being factor when you have a tall individual like that, that jumping point for your initial trial.
Sure. Well, it all has to do with their arm length, right? And usually wingspan. We look at that elbow angle, that top of wheel, you're trying to get somewhere ideally 100 to 120 degrees of that elbow flexion. Also looking at kind of middle to get close to the axle. Those are some kind of basic things that we look at, but then of course the dynamic component. So actually watching them push, if they're getting that cyclical motion or not. And in like Jared's case, he could pretty much immediately give us the feedback of what felt okay or not. So I don't know if that answers that. Sprinkle, do you have anything to add to it?
And I don't think 72 inches is the tipping point, but Celeste was introducing, when you're 6'7", that's getting up there. And I think Vuska, they're freakishly tall. But I think it's a good question. What's the tipping point? And I say we go to the Netherlands and find that out. Because they probably, do y'all deal with? Yeah, she's so busy. But my guess would be, 76 on up. I'd probably try it for sure. That's 6'4".
Go back to this side.
Hi there. I'm feeling freakishly short. It's to do with more long-term postural things, and I don't have the Dr. Sturgill bias, so we don't know this, but I find that my clients with SCI also develop, the taller they are, the more scoliosis. If you're incorporating any more or deeper lateral support from initial evaluation for your taller clients to kind of help present or invite them in, if I don't know if it's a true thing or not, but that I find that they do develop more scoliosis the taller they are over time.
I'm writing it down because I think that's a great question. I don't have an answer for that.
No, that's again very interesting. And I guess you're talking about folks that are 20, 30, 40 years down the road. you know, your consideration of back height is probably just as important as your consideration of lateral supports, and when you might have to, you know, have that chat and say, you know, you're 6'4", or you're 6'5".
Depends on who you're talking to, right? Because if you're the level of injury, they see other people, they don't think they need that kind of support, which is challenging to convince somebody who might be a thoracic level injury to getting something that has a deeper spine. You know, there might be more issues. I was just wondering if you were running into that as well.
Yeah,
think it's
I can't think of a data set that, in the United States, the model systems is by far the best longitudinal data. We might, but they had people since 1973, so it's a pretty cool data set. I don't know where else you would look at this kind of spinal, developing spinal asymmetry over decades. But that'd be really, really, really important.
And we didn't hit toe binders again in this conversation as well. I know that's something, at least at Shepherd, we're really trying to revisit that conversation with our inpatient therapists and with our teams to say, hey, like, not all going to come from the wheelchair, right? Using some kind of wearable support as well. Over to them.
Hey, hi. My name is Kevin. I'm an ATP out of California, and I want to clarify something. I'm a provider, and there's a very big difference when we are being viewed as a supplier or a vendor. There's a disconnect between the therapist and the provider. When you sit here and say we didn't see many backs that are above 20, there's 20 to figure that out. There's cushions that you can increase the overall seat height 1, 2, 3 inches. There's now chairs that go, a bunch of them go 24 inches deep. Okay, not just 22 or 20, because I've never had a power chair tip. There's a center of gravity adjustment, just like there is on manual wheelchairs. So instead of projecting it, tipped, and there's a couple of bolts you can adjust the manual chair where you want to place the body and this and that. If you're looking at a power chair where somebody's sitting behind the drive wheel, like on a mid wheel, we should both be able to see. Also make adjustments with these backs to compensate for those 2 inches or 4-inch difference. They make privacy flaps and things like that. So I think that it's about stopping with the vendor or supply best product. Not one entity is better, smarter, whatever. It's all about coming together for the best thing for that patient. So
100% agree.
Yeah.
Absolutely.
Hello, I'm Mark Smith. I am also from the night here under the sea level, so we need to breathe. So,
I love that.
and when we are talking about 210, this is about 82 inches, which is quite tall, but we see them. A lot of people with either unilateral or bilateral hip flexion limitations. And when you don't have that ability to have like a smaller, trunk to thigh angle, because then you have to open up, you then already are 82 inches. So then you sit with your head against the ceiling of you cannot bend enough. Any
Huge
factor from that?
You got HO out there and all sorts of things that, and then you got those obliquities. Absolutely, it's a challenge for sure.